Welcome back to OncoVerse, the channel where we break down cancer pharmacology, one drug class at a time. Whether you're a pharmacy, medical, or nursing student, or simply fascinated by oncology, this is the place for you. Today, we're diving deep into one of the oldest and most widely used weapons in the chemotherapy arsenal. Get ready to explore the world of microtubule damaging agents, a class of drugs that has shaped cancer treatment for decades and continues to evolve with new innovation. Let's get started on this journey through the science of cancer therapeutics. Every time a cancer cell divides, it constructs a tiny internal scaffold called the mitotic spindle, made entirely of microtubules. Unlike many chemotherapy drugs that attack DNA, today's agents target this scaffold itself. By freezing the spindle, the cell can never finish dividing. In this video, we'll cover how microtubules work, the two major drug families that target them, their mechanisms, clinical uses, toxicities, and how this drug class has evolved with the latest FDA approvals. Let's jump right in and see how these agents disrupt cancer at its core. Microtubules are made of alpha and beta tubulin protein pairs that stack into long, hollow filaments. These structures are never static. They're constantly adding and losing subunits, a property known as dynamic instability. This constant remodeling allows cells to build the mitotic spindle, move organelles, and maintain their shape. Microtubule damaging agents, often called MDAs, bind directly to tubulin and disrupt this dynamic balance. When the spindle can't function, chromosomes can't segregate, the cell gets stuck in metaphase, and ultimately it's pushed into apoptosis. Here's where things get interesting. You can disrupt microtubules in two completely opposite ways and still achieve the same outcome: mitotic arrest and cell death. Microtubule destabilizing agents like the Vinca Alkaloids block tubulin polymerization, causing microtubules to shrink. On the other hand, microtubule stabilizing agents like the Taxanes promote polymerization and lock microtubules in place, making them too rigid to function. Either way, the mitotic spindle stops working, and the cell cannot move its chromosomes apart, leading to cell death. Vinca alkaloids are natural plant alkaloids originally isolated from the Madagascar periwinkle. They bind to beta tubulin at a site distinct from taxanes, preventing the addition of new tubulin subunits and causing the mitotic spindle to fall apart. Without a functional spindle, chromosomes can't separate, so the cell freezes in metaphase and dies. These drugs have been a cornerstone in cancer therapy for decades, especially in treating various leukemias and lymphoma. Vincristine is a fast-acting drug, best known for inducing remission in childhood acute lymphoblastic leukemia. It's a backbone drug in regimens like R-CHOP and CHOP for lymphoma. What sets vincristine apart is its toxicity profile. Unlike most chemotherapy drugs, it causes very little bone marrow suppression. Instead, its dose-limiting toxicity is peripheral neuropathy, along with alopecia and occasionally SIADH. This unique side effect profile makes it a staple in pediatric oncology. Vinblastine is the B in the ABVD regimen for Hodgkin lymphoma. Compared to vincristine, it has more bone marrow suppression but less nerve damage. Like all Vinca alkaloids, it's a severe vesicant, meaning extravasation can cause significant local tissue damage. Vinorelbine, a semisynthetic analog, is mainly used for non-small cell lung cancer, with neutropenia as its dose-limiting toxicity rather than neuropathy. Each drug in this family has its own unique profile and clinical niche. The other side of the spindle war are the taxanes. Paclitaxel was originally isolated from the bark of the Pacific yew tree. Taxanes bind beta tubulin at a site distinct from the Vinca alkaloids and do the opposite job. They stabilize microtubules, making them too rigid to disassemble. A spindle that can't disassemble is just as broken as one that can't assemble, so the outcome is the same: mitotic arrest and apoptosis. Taxanes are now standard in many solid tumor regimens. Paclitaxel is a workhorse in ovarian, breast, and lung cancer. Because it's formulated in a solvent called crema for EL, it carries a real risk of hypersensitivity reactions, so patients are premedicated with steroids and antihistamines. It also causes a classic stocking and glove peripheral neuropathy. Docetaxel is more potent than paclitaxel, tends to cause more neutropenia but less neuropathy, and is a key drug in prostate, breast, and gastric cancer. Let's bring things up to date. Two newer taxane formulations solved real problems with the originals. Nab-Paclitaxel binds paclitaxel to albumin nanoparticles, eliminating the need for Cremafor and reducing allergic reactions, while delivering more drug directly into tumor tissue. It's now standard in metastatic pancreatic cancer alongside gemcitabine. Cabazitaxel was engineered to evade the P-glycoprotein pump, making it effective in prostate cancer that's already resistant to Docetaxel. Drug worth knowing that often gets left out of the classic Vinca versus Taxane story is Eribulin. It's a synthetic analog of a compound originally isolated from a sea sponge, and it's a microtubule destabilizer, but it binds tubulin at a unique site, distinct from the Vinca binding domain. It's approved for metastatic breast cancer after at least 2 prior chemotherapy regimens and for liposarcoma. Its main dose-limiting toxicity is neutropenia, and it also carries a risk of QT prolongation. Biggest recent shift in this drug class is the use of microtubule poisons as payloads in antibody-drug conjugates, ADCs. These combine a monoclonal antibody with a potent microtubule disrupting molecule, delivering the drug straight to the tumor cell. Brenximab targets CD30 in Hodgkin lymphoma, enfortumab targets Nectin-4 in bladder cancer, and polatuzumab targets CD79B in lymphoma. Belantamab mafodotin, targeting BCMA, is approved for relapsed or refractory multiple myeloma. The underlying weapon is the same: poison the microtubule, but now with much greater precision. Resistance is a real clinical problem with this class. The most common mechanism is overexpression of P-glycoprotein, an efflux pump that actively removes the drug from cancer cells before it can act. Tumors can also alter the structure of B-tubulin itself, changing the binding site so the drug can no longer attach effectively. This is why newer agents like Cabazitaxel were designed to be poor substrates for these efflux pumps, helping to overcome resistance. You remember one thing from this video, remember this: neurotoxicity is the signature side effect of microtubule damaging agents. Microtubules are essential for axonal transport in neurons, so damaging them doesn't just stop dividing cancer cells, it can also disrupt healthy nerve fibers. Watch for extravasation injury with Vinca Alkaloids and hypersensitivity reactions with Paclitaxel. Always assess for numbness, tingling, and weakness in patients receiving these drugs. Recap: microtubule damaging agents stop cancer cells from dividing by either preventing microtubule assembly, like the Vinca Alkaloids and Eribulin, or by locking microtubules in place like the Taxanes. While the classic drugs are still widely used, the biggest innovation has been using these same molecules as precision payloads on antibody-drug conjugates, achieving the power of the original drugs with much more targeted delivery. That's a wrap on microtubule damaging agents. If this helped you understand Vinca Alkaloids and Taxanes a little better, be sure to subscribe to OncoVerse for more oncology pharmacology. Stay tuned for our next video where we'll break down another essential drug class in cancer therapy. Thanks for watching and see you in the next one.